affect your family and friends, and you might not even know about it. For many people, mental illness keeps them fighting in the shadows.
But even as awareness increases nationwide, barriers remain for people in the Black community. In
this To America's report, KSHP 41 News reporter Megan Abundis introduces us to one man who's hoping to remove the stigma of seeking help.
Me being transparent, is okay.
Just like the needle. In life, Trey Hill knows all too well about the ups and downs.
As far as someone with a mental health condition, I have one. And I'm okay saying that.
Transparency for Hill is social media, sharing truths about mental health, access, statistics, and what he's been through.
I promise you guys that's going to take you on this ride with me.
Sports injuries, deaths in the family, and past traumas. His life experiences now on display to help break a deeply rooted problem.
In the Black community, in mine in particular, it was something we looked at as if it wasn't real. Depression is something that if you're strong enough, you can just get past.
But now he's changing the narrative.
I need it to not be a weakness. And I think a lot of people need it to not be a weakness, to start, accepting some of the things that they're going through so that they can get better.
He's starting with these 21 hats, exposing an issue that's often fought in silence and stitching together conversation.
Scientifically, it takes 21 days to make a habit or break a habit. If we can find a way to raise awareness and show people how important it is and how much of a disconnect it is between the Black culture and that help, I believe we can affect some change.
But awareness isn't the only key. Licensed professional counselor Bert Rogers says there can be many barriers.
Sometimes it can be the cost. Sometimes it can be the history of how mental health practitioners have seen the African American community as a whole.
He says repair starts with cultural competency.
I'm from the 30s here in Kansas City, so the 30th area of Kansas City. And there are a lot of details about just the trauma history that would be there that wouldn't necessarily take place out in the suburbs. So, the idea of how someone responds to hearing gunshots, or the fact there are gunshots. As a clinician, it behooves me to understand that for my clients. To understand when they talk about a shooting that happened last week, it might be helpful to ask which one, rather than oh my goodness, there was a shooting. They're like, no, it's multiple. The frustrating aspect is the infrastructure hasn't changed.
There's more of a need for mental health during these times than ever, and we have to get over the stigma, and the only way you're going to get over the stigma of mental health in the Black community is for us to do more outreach and help people understand that mental health is just as important as clinical health.
Joseph Palm is the Missouri chief of the Office of Minority Health. He admits there are gaps when it comes to access in the Black community. He urges state and local partnerships, first responder education on handling traumas, and more funding.
It's a monumental task, and it's going to take all of us.
Because they know by gathering the threads of your life, health comes together one stitch at a time.
I just want to be able to shed some light on it being okay to not be okay. A lot of people deal with it. A lot of people don't know that they're dealing with it, or that other people, can help them with that.
Megan Abundis, KSHP 41 News.